Welcome back to PodBites. In our last episode, we talked about complications of prematurity, things like NRDS, apnea, ROP, IVH, and EC. Basically every system that premature infants like to challenge. Now we're switching gears to neonatal respiratory disorders that happen even in full-term babies. And I want to start with something that freaks parents out but is actually normal: periodic breathing.
So, periodic breathing is when the newborn has brief pauses in breathing, usually less than 20 seconds, followed by rapid breathing. It can look dramatic, but as long as there's no color change, no bradycardia, and no oxygen desaturation, it's physiologic and totally normal.
So that's like the NICU version of don't panic unless they turn blue, right?
Exactly. And unlike true apnea of prematurity, periodic breathing requires no treatment.
Alright, now let's move on from normal physiology to something that's actually a diagnosis: transient tachypnea of the newborn, or TTN. This one shows up more in term babies, right?
Exactly. TTN is basically wet lungs, retained fetal lung fluid. It's especially common after C-section deliveries because the baby doesn't get that vaginal squeeze that helps expel lung fluid.
So they breathe fast, but not in that severe kind of distress?
Right, you'll see tachypnea, but usually no severe retractions or cyanosis like NRDS. They just look like they're breathing fast, almost like they're catching up, but overall comfortable.
And what are we expecting on the chest x-ray?
Classic findings include hyperexpanded lungs, perihilar linear streaking, and fluid in the fissures. These are all signs of retained lung fluid rather than surfactant deficiency.
And the best part, prognosis?
It's truly transient. It usually resolves within 1 to 3 days with simple supportive care. No long-term issues.
So TTN is basically the newborn saying, give me a moment. Now let's shift from mild to something much more dangerous: Meconium Aspiration Syndrome, or MAS. This usually affects post-term neonates, right?
Right. Classic clinical picture. You have green amniotic fluid, then the baby is born, and shortly after you see respiratory distress, cyanosis, and tachypnea. On chest x-ray, you'll see coarse infiltrates due to meconium blocking the airways and causing inflammation.
And this is one of those situations where the initial management depends on how the baby looks immediately after birth. If the baby is depressed, low heart rate, poor breathing, what's the next best step?
In a depressed baby, we intubate and suction the trachea before stimulation. We don't stimulate first because that increases the chance that the baby will inhale more meconium.
And the most serious complication we worry about in MAS?
Persistent Pulmonary Hypertension of the newborn, or PPHN. Meconium can cause pulmonary vasoconstriction, leading to elevated pulmonary pressures and right to left shunting, so the baby remains hypoxic.
Okay, so TTN says, I need a minute, but MAS says this kid needs some serious help right now. Before we close episode 2, let's check ourselves with 2 quick questions. What is the key cause of transient tachypnea of the newborn? And which serious complication of Meconium Aspiration Syndrome leads to right to left shunting and severe hypoxemia? Think about them while we recap. We started this episode by explaining that periodic breathing, brief pauses followed by normal respirations, is actually normal in newborns and not the same thing as apnea.
Then we moved into transient tachypnea of the newborn, which happens because of retained fetal lung fluid, especially after C-section delivery. These babies breathe fast, but usually aren't in severe distress, and chest x-rays show hyperinflation with perihilar streaking and fluid in the fissures.
And importantly, TTN is generally mild and managed with supportive care. It usually resolves on its own within 1 to 3 days.
After that, we discussed Meconium Aspiration Syndrome, which typically occurs in post-term infants exposed to meconium-stained fluid, and then presents with respiratory distress and coarse infiltrates on chest x-ray.
And if the baby is depressed at birth, low heart rate, not breathing, intubation and suctioning are the first step before stimulation.
Then we introduced persistent pulmonary hypertension of the newborn, the dangerous complication where pulmonary vessels don't relax, leading to right to left shunting and severe persistent hypoxemia. So just to remind everyone, our first question was, what causes transient tachypnea of the newborn?
And the second question was, what was the serious complication we worry about in meconium aspiration?
So your answers were retained fetal lung fluid for TTN,
and persistent pulmonary hypertension in the newborn as the feared complication for meconium aspiration.
And that brings episode 2 to an end.
Next time, we'll dive into catastrophic neonatal events. Thanks for learning with us, because tiny humans deserve big knowledge.